Hi, this is Dr. Cliff Gronseth coming to you with another Cliff's Riffs. Today we're going to be talking about ultrasound, the power and beauty of ultrasound. For those that don't know, Spine West is very proud of our ability to use ultrasound waves to help with diagnosis. Today I'm going to go over the general history and overview of use cases for ultrasound. As you know, ultrasound is really just sound waves that reflect off layers inside the body, allowing us to identify things that look normal or not normal. The history of ultrasound was developed from nature. As you know, there are animals that use ultrasonic waves. Those are waves that are beyond our hearing ability that can identify moving objects and get the reflected wave back to perhaps capture dinner, for example. The military used it to identify underwater or marine defensive and strategic tools because sound waves travel well in water. It does not travel well in air. But in water, if you think about whales talking to each other over long distances, the water is a medium through which sound travels very well. Outer space with nothing, with a vacuum, there's actually very little or no sound wave transmission because there's nothing to move the mechanical wave of ultrasound. But the technology that was developed by the military was converted into healthcare. In fact, the very first experiments with using ultrasound for the human body and for medicine were developed at CU Boulder, something called the Hubbard tank, like a giant bathtub with metal walls. They pounded the sides and they listened for the echoes of the sound waves to come back after reflecting off this person's body sitting in the tub. And they've now converted this technology into a handheld little probe that can be used to identify real-time moving objects like hearts. As you know, they can use it for kidneys and the abdomen, liver, the appendicitis, and the gut can be used. Pelvic ultrasound, very commonly used. And we now use it for orthopedics, identifying tears of the tendons, fractures of bones, ligament tears, fluid collections. It's a beautiful technology that you can use at the bedside, and you can look inside the body, not just touching and feeling where it hurts, but actually looking to see what may be damaged. We use it on many joints: the shoulder, elbow, wrist, hand, hip, knee, foot, ankle. You can use it for doing ultrasound guided injections. You can see the needle coming in and placed exactly where you want it to go, drain the fluid, put the medicine in, and you know with 100% confidence that you got the medication in the right place. Ultrasound does have its limitations. Unlike an MRI, an ultrasound cannot see deep inside the crevasses of the body. For example, inside of a joint between two bones. Because the sound wave comes in and reflects off of the different layers, it is not able to bounce around inside of a joint and bring back an image that would have any value. So an MRI does have superiority for looking inside joints. However, the MRI has to be done with the body held perfectly still. An ultrasound can be done dynamically, looking at the body moving, looking where the fluid goes, looking if a tendon spreads, if it's torn, etc. So the ultrasound and the MRI are quite complementary in that the ultrasound has the ability to be immediate and bedside and is completely safe, just like an MRI is safe unless you have a cardiac pacemaker. But the ability to look at things dynamically is something that the MRI cannot do. The other advantage of the ultrasound is that it's portable. This is an ultrasound machine in my hand. This will display on a phone, on a smartphone. And that is a lot different size and a lot more portable than an MRI machine taking out to a remote village. So the ultrasound is been moving more and more into the medical care space, it's a little bit difficult to learn, and that's been the limitation for its adoption in the current healthcare system. But medical schools are now teaching ultrasound more and more, and you will see in 10 years that this will be in doctors' pockets rather than a stethoscope. Because why would you listen to the body, listen to the bowels, and listen to the heart when you can look at it and see it? The ability to look at the brain is still quite limited because the dense bones prevent the sound waves from penetrating the bone well to see the brain structures. There are some use cases of the ultrasound looking at the blood flow in the brain, but that's the main extent of using it in an adult skull. A baby's head, it has fontanelles, kind of unsealed bones that can be used as windows to identify problems as needed. And they use this in the OR sometimes when they do have part of the skull removed. And as you know, it can be used for pregnancies. That is fairly universal in kind of the Western world or the high-income countries. Everybody that's born in the high-income countries will likely have seen ultrasound waves when they were the size of your pinky, or certainly in the mother's belly, because it can identify things that maybe are normal or not normal. It can also be used to identify breast cancer. The ultrasound signature of cancer looks different than a benign breast cyst or a lump. So you can use this to help screen for breast cancer for further evaluation. I started a nonprofit that teaches how to use these portable ultrasound machines in rural areas of the world, in the remote villages, the places where healthcare is hard to deliver. And the ability to do screening for pregnancies that may kill the mother or the baby, breast cancer, bleeding in the belly, fractures, anything that can be used to triage or identify high-risk conditions, kind of like a crystal ball, and send the patient to higher care if needed, just with a safe, portable, sound wave emitting little tool and a phone or a tablet computer is all you need. For example, I'll show you right now how immediate and safe the ultrasound is. I will put this on my skin under my shirt, and you will see my heart beating right here. This is real time. This is my heart. In fact, you can see my aortic valve, that little circle right there that I'm looking at. That's real-time ultrasound, completely safe and immediate. So the power of looking inside the body is just tremendous. So with that, I just wanted to emphasize that ultrasound will be the technology of the future in my mind. And if you have any questions about it, certainly give us a call. Spine West is very proud of our long-term commitment to ultrasound. We've been doing it for, at least I've been doing it for over 20 years, and it is the most amazing diagnostic tool that we have, simply because it's so safe, it's so portable, and it's so immediate. Hope you have a great week. Stay well, and we'll see you next time. If you have any suggestions for other topics, please let us know. We will try to cover those as they're needed.